Good morning, Cleveland. As you step outside today, you might notice something unusual in the air. A thick haze hanging over the city, muting the familiar skyline and casting a surreal glow over the streets below. The city feels quieter, almost as if the world is holding its breath. If you've noticed the sky looking milky and the sun glowing orange, you're not alone. This isn't your imagination or a trick of the light. The sun's rays are struggling to pierce through a blanket of smoke, giving everything an eerie, otherworldly tint. It's a sight that's hard to ignore, and it's left many Clevelanders wondering what's going on. That campfire smell in the air, it's not coming from a backyard barbecue or a local bonfire. It's smoke from wildfires burning hundreds of miles away across Canada, carried here by shifting winds and atmospheric currents. These fires are so massive and intense that their smoke has traveled across borders, blanketing much of the Midwest, including Northeast Ohio. Our air quality has dropped, prompting a health advisory from the Cleveland Department of Public Health. Officials are urging everyone to pay attention to air quality alerts, especially as the levels of pollution rise to unhealthy levels. Digital signs across the city flash warnings, and local news outlets are keeping residents updated on the latest conditions. This isn't just a visual oddity. Tiny, invisible particles in the smoke can harm our lungs and hearts. These particles, known as PM2.5, are small enough to slip past our body's natural defenses and settle deep in our respiratory system. Even if you can't see them, they're there, and they can cause real health problems, especially for those with asthma, heart disease, or other chronic conditions. You might feel a scratchy throat, watery eyes, or a cough. These are real effects of distant fires. Some people may also experience headaches, shortness of breath, or fatigue. Children, the elderly, and anyone with pre-existing health issues are especially vulnerable. Even healthy adults might notice discomfort after spending time outdoors. Today, we'll break down how this smoke travels hundreds of miles, what air quality warnings really mean, who's most at risk, and how you can protect yourself and your loved ones. We'll also look at the science behind the air quality index and why it matters for your daily routine. Plus, we'll share practical tips for staying safe when the air turns hazardous. Staying informed is our best defense. By understanding the risks and knowing how to respond, we can all take steps to protect our health and our community. Let's get started. Have you ever wondered how smoke from wildfires burning hundreds or even thousands of miles away in Canada can end up blanketing the skies over Cleveland? It might seem impossible that something happening so far away could have such a direct impact on our city, but the answer lies in the invisible forces at work high above us. It's all about the atmosphere, the vast ocean of air that surrounds our planet. The atmosphere acts like a giant highway system, moving air, moisture, and yes, even smoke across continents and borders. When wildfires rage, they don't just affect the immediate area. Their smoke can be swept up into the upper layers of the atmosphere, where powerful winds take over. Wildfires send massive plumes of smoke and fine particles high into the sky. Once there, strong winds, especially the jet stream, which is like a fast-moving river of air, can carry these particles for thousands of miles. The smoke can travel over forests, lakes, and even entire cities, crossing state and national borders with ease. Sometimes you can even see these smoke plumes on satellite images, stretching from Canada all the way to the Midwest. But it's not just the wind that matters. High-pressure systems can act like a lid, trapping smoke close to the ground. When this happens, the air becomes stagnant, and the smoke can linger for days, turning our skies a milky gray and making the sun look like a faint orange disk. This is why, even if the fire is far away, we can still experience poor air quality right here at home. The main concern with wildfire smoke is the fine particulate matter it contains, known as PM2.5. These are tiny particles about 30 times smaller than the width of a human hair. Because they're so small, they can stay suspended in the air for days and travel deep into our lungs when we breathe. You might not always see them, but they're there, floating in the air and affecting our health. Once inhaled, these particles can even enter our bloodstream, causing inflammation and a range of health problems. For people with asthma, heart disease, or other respiratory conditions, wildfire smoke can be especially dangerous. Even healthy people might notice coughing, irritated eyes, or difficulty breathing on smoky days. So, a wildfire burning in Quebec can trigger a health advisory here in Cleveland. It's a powerful reminder that what happens in one part of the world can have real consequences for people living far away. Our air is shared. and the effects of distant events can reach us in ways we might not expect. Our shared atmosphere connects us all, making distant events impact our daily lives. Cities hundreds of miles apart can experience the same hazy skies and health warnings, all because of the way air moves around the planet. It's a reminder of how interconnected we truly are. That's why it's so important to pay attention to air quality alerts, even if the danger isn't immediately visible. These warnings help us protect ourselves and our loved ones from the hidden risks in the air we breathe, no matter where the smoke originally came from. The Air Quality Index, or AQI, is your essential guide to understanding how clean or polluted the air is around you at any given moment. It's a tool designed to help everyone, from city dwellers to suburban families, make informed decisions about their daily activities based on the quality of the air they breathe. Whether you're planning a jog, a family picnic, or simply your commute to work, knowing the AQI can help you protect your health and the health of those you care about. The AQI is presented as a simple, color-coded scale ranging from 0 to 500. The lower the number, the cleaner the air. As the number rises, so does the level of pollution and the potential risk to your health. This scale is easy to read and is designed to be accessible to everyone, regardless of age or background. Each color on the AQI chart represents a different level of health concern. Green means the air quality is good and poses little or no risk. Yellow indicates moderate air quality, which is generally acceptable, but may pose a slight risk for some people who are unusually sensitive to air pollution. Orange signals that the air is unhealthy for sensitive groups such as children, the elderly, or those with respiratory conditions. Red means the air is unhealthy for everyone, and prolonged exposure should be avoided. Purple and maroon represent very unhealthy or hazardous conditions, where everyone may experience more serious health effects. Today, for example, Cleveland finds itself in the orange zone. This means the air quality is considered unhealthy for sensitive groups. On days like this, it's especially important for people with asthma, heart conditions, young children, and older adults to be cautious. If you or someone in your family falls into a vulnerable group, it's wise to take extra precautions. Limit your time outdoors, especially during peak pollution hours. Avoid strenuous activities that make you breathe harder, and consider keeping windows closed to prevent outdoor air from coming inside. Even healthy individuals may want to adjust their routines to minimize exposure. Remember, the AQI isn't static. It can change throughout the day as weather patterns shift and pollution levels rise or fall. That's why it's a good habit to check the AQI before heading outside, especially if you plan to be active or spend extended time outdoors. Many weather apps and websites provide real-time AQI updates, making it easy to stay informed. By monitoring the AQI, you empower yourself to make smart, real-time decisions for you and your loved ones. Whether it's rescheduling outdoor plans, choosing a different route for your walk, or simply deciding to stay indoors, these choices can make a big difference in your overall well-being. Don't ignore air quality alerts when they pop up on your phone or appear on public signs. These warnings are issued by experts who monitor pollution levels and are there to protect your health. Taking them seriously can help you avoid unnecessary risks, especially on days when pollution spikes unexpectedly. Staying updated on the AQI and adjusting your plans as needed is a simple yet powerful way to take control of your health. By making air quality awareness part of your daily routine, you can breathe easier and live smarter, no matter where you are. Not everyone is affected equally by smoky air. Sensitive groups, like people with asthma, COPD, heart disease, older adults, and children, face higher risks. For those with lung or heart conditions, smoke can trigger severe symptoms or even emergencies. Children breathe more air per pound and spend more time outside, increasing their exposure. Outdoor workers and residents in communities with higher rates of asthma or less access to clean air are also at greater risk. Cleveland's Black and low-income neighborhoods often face compounded challenges. If you or someone you know is in these groups, take air quality alerts seriously and have a plan. Protecting our most vulnerable is a community responsibility. When air quality is poor, limit your time outdoors, especially in the afternoon and evening. If you must go out, choose light activities over strenuous ones and move workouts indoors. Outdoor workers should take frequent breaks in cleaner air and watch for symptoms. On high alert days, wear a well-fitting N95 or KN95 mask for extra protection. Listen to your body. If you feel coughing, chest pain, or shortness of breath, get inside, and seek medical help if needed. Postpone activities that can wait, like yard work or jogging. These simple steps can make a big difference for your health. Stay alert and adjust your routine as needed. You can control your indoor air, even when it's smoky outside. Keep windows and doors closed and set your AC to recirculate. Upgrade to a high-efficiency, MERV 13 or higher filter in your HVAC system. Use a portable HEPA air purifier in the rooms you use most. Avoid burning candles, frying food, or vacuuming without a HEPA filter during smoke events. These steps create a cleaner air zone in your home, a safe haven from the haze. Protect your lungs by making your home a sanctuary. Reliable information is key. Check AirNow.gov for real-time local air quality updates. Download the AirNow app for alerts on the go. No internet? Call the Cleveland Department of Public Health hotline at 216-664-7442 for guidance. Community groups like the Northeast Ohio Black Health Coalition are distributing free air purifiers to those in need. Stay connected to official sources and community programs. They're here to help. Share these resources with friends and neighbors, especially those who may be vulnerable. A few minutes checking the AQI can help you plan your day safely. Information and community support are your best tools. Why are smoky skies becoming more common? Climate change is fueling bigger, hotter wildfires. Canada's record-breaking 2023 fire season burned 18 million hectares, far above the average. Hotter, drier conditions turn forests into tinderboxes, making fires larger and smoke more widespread. These trends mean more frequent air quality alerts, even far from the flames. We're also in ozone season, so pollution can double up on hot, sunny days. This isn't a one-off event. It's part of a larger pattern tied to our warming climate. Short-term steps protect us now, but long-term solutions are needed to address the root causes. The health of our planet and our community are deeply connected. As the sun sets through a hazy sky, remember, we're all in this together. By understanding the risks and taking action, we protect ourselves and each other. Simple steps, limiting outdoor time, using air purifiers, checking AQI, add up to a healthier community. Check in on neighbors, especially the elderly or those with health conditions. Share information about local resources and support programs. Our collective care is Cleveland's strength. The haze will pass, but the lessons remain. Stay informed, stay prepared, and look out for one another. Together, we can breathe easier, today and in the future. Stay safe, Cleveland.